All right, we're going to go ahead and get started. This is Mary Sheridan with the Bureau of Rural Health and Primary Care. We're part of the Division of Public Health in the Idaho Department of Health and Welfare, and I would like to welcome you to our SHIP, which is the Statewide Healthcare Innovation Plan, the SHIP Telehealth Grant Application Technical Assistance webinar. Welcome clinics and stakeholders and staff. Good morning if you're in North Idaho, and good afternoon to the rest of you. We are going to record this and we're going to post it to the SHIP website. So if you have questions or if there's something else you want to listen to again, or if you know of a clinic that maybe couldn't attend right now, please feel free to share the webinar. And we usually get that posted pretty quickly. We can get that turned around. So I would imagine maybe by later this afternoon that recording should be available on the SHIP website. So welcome. We did want to let you know we encourage you to please self-mute if you would. I think that might make it easier then for you to chime in and ask questions. If there's a lot of background noise, though, we'll go ahead and mute your line just so we can continue uninterrupted. If you do have questions as we go, please feel free to either use the chat box. You're welcome to do that, or if you just want to unmute, ask the question. I really encourage you to do so. I think it'll make it a lot easier, even if you're willing to ask questions as we go through instead of saving it till the end. But when we get to the end, if there's something that you thought of, please don't hesitate to ask. So just a few things that we're going to cover today. We're going to walk through the grant application process, the requirements, and the funding opportunity available through the Statewide Healthcare Innovation Plan. And again, I encourage you to ask questions along the way, either phone or chat. And again, you also have my email. So if there's something that you think of later, please don't hesitate to email me or ask. If you could please self-mute your line, we would really appreciate it. So thank you. So as you likely know, this funding opportunity is for SHIP Cohort 1 clinics or community health EMS agencies that are part of that first cohort to establish or expand a telehealth program. And this telehealth is a component of the virtual patient-centered medical home, which is part of Goal 4. And the purpose of the virtual patient-centered medical home is to improve access to healthcare services in our rural and underserved communities by establishing community health worker programs, community health EMS or community paramedic programs, and telehealth programs. And our goal as part of this initiative is to establish 36 telehealth programs statewide by January 31st of 2019, which is the end of the SHIP grant year. As you likely know, SHIP is a 4-year grant from CMMI, which is the Center for Medicare and Medicaid Innovation. Just as a reminder up front, I'll say this a couple of times, is that CMMI has denied the use of this funding for telehealth equipment. And we'll talk more about that as we go through the webinar this morning or this afternoon. So this is the available funding under this opportunity. We anticipate providing 8 to 10 awards. And again, much of that will depend on the dollar amount requested. The maximum available in the grant, I hope that you've reviewed the grant application. The maximum that you can request is $25,000, and that is per clinic location or per CHEMS agency for applicants. And I want to remind you as well, and I'll talk about this a little bit more, we are actually in the process of releasing an RFP to secure consultative services through a vendor, essentially. So we're releasing the RFP. The purpose of that RFP will be specifically to provide technical assistance to every clinic or CHEMS agency that is funded under this opportunity. So again, as we go through or as you're considering submitting an application, just please keep in mind you won't need to request funding to provide consultative services to you. And we really think that's one of the things that we can do to help assure your success. These are the key dates. Again, these are in the application. So the funding release, the application deadline, I just want to remind you, is April 27th. So you don't have too terribly long to create this application, but I hope that it's enough time for you. And we'll receipt those applications via email to the Rural Health inbox, and that's our email address is included in the application package. So all of these applications will be reviewed by an independent grant review committee, and that committee will meet in late May, and we anticipate notifying every applicant about the status of their application and an award decision on May the 23rd. So given that it will take a bit of time to actually get these projects in place, these we'll establish these with successful grantees through the sub-grant process. We estimate a start date of June the 16th. So you'll want to keep that in mind as you're building your timeline in your project application. All funds will have to be expended by January 31st of 2018. That is the end of SHIP Award Year 3. But we have extended the project end date into August just because we think it takes a little bit more time truly to establish a successful telehealth program. So what I thought I would do is just to walk you through the grant components, and you'll see the weights here for each of these sections and obviously in your application as well. So the first review criteria considered then by the review committee that you'll want to address is to provide us with an executive summary. This is where you really can provide the details about your initiative, but again, think of this as a snapshot. No more than 1 page in length. So this is really a clear, concise overview of that project that will provide that reviewer with a pretty good idea about what to expect in the rest of your application. So you want to include your project goals, information about your organization as the applicant, and really make that linkage. Talk about how your organization can help assure the success of this initiative. And consider maybe successful experience with other projects that wouldn't have to be telehealth, because we certainly expect that many of these telehealth applications and these projects will be brand new to many organizations, if not maybe all organizations. So that experience doesn't have to be about telehealth, but you really want the reviewers to see how your organization has the capacity and expertise to be successful in this initiative. So your project description, 25% of your total, this is really your opportunity to share the details about your initiative. So you're going to want to address staff roles and responsibilities, your timeline. Again, make sure your timeline is aligned with the project period as described in this application. And you want to really be reasonable about what you can successfully accomplish within that time frame. Remember, this is only a 15-month project period, so you don't need to tell us that you're going to tackle the world when maybe you can't really tackle the world in 15 months. So we would expect you to be reasonable, but to also be very clear in your goals and objectives. Make sure that you connect your project not only to the SHIP grant and the purpose of the SHIP grant, but also to your target population. So if you recall earlier when I mentioned the virtual patient-centered medical home, this is all about improving access to health care for our rural and underserved population. So keep that in mind and really be clear on how your project will do that. And again, we do want you to address in this section your equipment needs and how you're going to go about securing that equipment. So if you do need a specific piece of equipment for this project, indicate certainly that you know that it's not going to be funded by SHIP, but if a piece of equipment is key to your success, the reviewers will really want to know how you're going to go about securing that equipment. If it's something you already have, please go ahead and tell us that. It doesn't have to be new. If within your project, if you rely on other partners or other organizations, and if they are key to this initiative, if you have MOUs, please include them. You're not required to do this. We don't, so the team won't expect or require you won't receive less than the available points if you don't have partners. But please, if you do, just make sure you address what they're responsible for and how they are key to your initiative. So targets and indicators. So as you know, SHIP is a model test grant. So it's important for us to be able to identify the impact of telehealth. So what we are requiring in terms of indicators, you see these two. So these two access to care measures are required for all projects. So this is really your commitment, and you will have to identify this commitment in this section, is to report the number of unique patients receiving telehealth services and the number of completed telehealth visits. So those two are required for every project. If you are applying for an expansion, so let's say you already have telehealth, but you want to add another scope of telehealth services. You want to add telecardiology, teledermatology, whatever that might be. Please make sure that you identify your baseline and then your anticipated target. And again, that is required only if that is an expansion project. As you can see, we're not requiring, if this is brand new to you, we're not requiring you to put in the anticipated total. Quite honestly, we thought that might be pretty tough to do if you're brand new to telehealth. So please make sure that you identify in this section these two measures. Again, add your baseline, and you'll be required to report quarterly on these two metrics. So one more measure is required, and that required measure you can choose from one of the following three. So please select whichever one of these makes sense to you, whichever one you think will demonstrate the best impact on your telehealth program. So the three options are no-show rates, so comparing the no-show rate in your clinic with a traditional appointment versus no-show rates for your telehealth appointments. Or you can choose the patient perspective on the telehealth experience, and that survey is included in attachment D. Or you can choose to submit information on the primary care clinician or the CHEMS provider perspective on telehealth. And that survey is found in attachment E. So from our perspective, we would like for you to report quarterly on whichever one of these measures you choose. So you'll report quarterly, same timeline on each of the three metrics. And whichever one of these you want to choose is certainly fine with us. So please, whatever seems to make sense for you. We don't want this to be burdensome, but again, we really have to test this concept, and we're really collecting information about the impact of these telehealth programs. So I hope that you will take a look at attachment D if you're looking for the questions about how to capture the patient perspective, or look at attachment E if what you really want to measure is the provider perspective on the impact of telehealth in your clinic or in your CHEMS agency. And if you take a look at either D or E, we are really letting that frequency up to you as to how frequently you administer those surveys. We have provided some suggestions. That's at the very top of the page. But we will rely on you to really have that expertise in decision making. So again, as you can see, those are required. So you have 3 that are required. If you have additional measures that you really think are key to demonstrating your success, please go ahead and include them. They're not required, they're optional. We've provided you with some ideas, and actually we have a number of ideas on pages 9 and 10 of the application. But again, please select what makes sense for you. If it's nothing from this list, fine, choose whatever it is that you think is a relevant metric. So the next section, where 25% is scale, innovation, and design. So this is really your opportunity to describe how your project uniquely addresses an unmet need in your area, or maybe it's something truly unique to your area. So when it comes to scalability, it would be great for you to share with us how you truly believe that your project can be adopted or adapted in other clinics in Idaho or in other community health EMS agencies in Idaho. We also want you to address sustainability, and you see there what we ask for is a reasonable sustainability plan. So please describe the steps that you have in place to help assure that your program will continue beyond the funding period. And this is limited to 2 pages. The next component is budget. Budget is 15% of your total. And if you would refer to attachment C for the details and some of the restrictions. So I've included some of them here, but this is definitely not the entire list. But please create a budget that's reasonable, that the reviewers can clearly see is aligned with your project goals. If you're requesting, for example, personnel, make sure that reviewers can clearly see the personnel that you're requesting in your budget, that they can see that same person in the roles and responsibilities and in this project description and this project narrative that you have already provided. So again, excuse me. Can you get that? No? If you could please self-mute. Thank you so much. No? All right. Well, we have some background noise. If you can self-mute, we would appreciate that. So again, when it comes to budget, any item that you are requesting in your budget, please make sure that as a reviewer, that person can clearly see the linkage in your project. So as a reviewer, I always think when I get to the budget, if I have a really good understanding of your project, it should be really simple for me to link every single item that you've requested back to your project. So make sure that when you're finished that you can see that linkage too. Again, as you know, you cannot use this for equipment. There are definitely other things that are prohibited by CMMI. For example, you can't use funds to pay for any direct patient care services. You can't use funds for food. So please take a look at page 7 of the application for that entire list of unallowable costs. And if you have questions about those, please don't hesitate to ask. We also, in that budget narrative, I guess we definitely have the list of what you can't use the money for. I think we also have some ideas for what you can use the money for: personnel, meeting expenses, subcontractors, internet connectivity. But again, make sure that this is linked directly to your project, and it is really key to your success. And again, just that reminder, do not include funding for technical assistance for someone to actually help you develop and implement your project. That's something that will be included in the RFP. And so finally, as far as the review criteria, this doesn't add any points to your application as far as letters of support. We're actually not requiring letters of support. I would say that one exception would be we would expect to see a letter of support if you are collaborating with another partner. So please, if that depends on collaboration, if you have an MOU for whatever that is key to your initiative, please make sure to include support from that project partner. Regardless of how much collaboration you have going on, we only want to see a maximum of 3 letters. And again, this section is not scored. And lastly, demand analysis or a readiness assessment. So when we first started down this path with SHIP and telehealth, we had a webinar series. And we started off that webinar series to support the development of telehealth with a tool for conducting a demand analysis and a tool for conducting a readiness assessment. I felt it was really important to be able to answer the question, how do I know I need it, or how do I know I even want it, or how do I know I'm ready to take this on? So on the SHIP website, within that webinar series, we have those demand analysis and the readiness assessment tools. You are not required to do either of these. You are not required to use either of these tools. However, if you have conducted a demand analysis or if you have conducted a readiness assessment, please include them here. We will provide up to 5 bonus points for including these, but again, they're not required for your grant application. And again, if you are doing these or if you've done these at any point in the past, you can use whatever tool that best meets your needs. And these are a few other requirements just to keep in mind. And I would encourage you, as you review these, it would be helpful just to express your commitment or your support for doing these things. I think that's something you could easily weave into a sentence, even in your project description or wherever you think it makes sense. So these other 3 grantee requirements are participating in an on-site meeting. So this is a technical assistance contractor. The RFP that we're going to release, we're going to require them to actually go on site to the clinic or to the CHEMS agency to help support your program development. So if you are funded, that is something that you should expect to do, and we actually hope that you find value. I guess the exception might be if you feel this isn't needed for you because this is an expansion and you have a lot of experience with telehealth, we can certainly talk about that. We would ask, and we don't want to be a burden on you, but we really see as checking in with you no more than quarterly, either the technical assistance contractor or someone from the SHIP team, really just checking in with you and as a way to help assure your success, but certainly not to be a burden. And then finally, we talked about the metrics. You will need to submit quarterly on all 3 required metrics and any optional metrics that you have identified for your program. And that is all that I had today. Do you have a question? Yes. Unmuted the line. Oh, actually, all the lines are unmuted. If you have questions, certainly ask your questions now. We don't have anything in the chat box. But again, this is the email address to submit completed applications. You can also email your questions to our rural health inbox. If you would rather call, that's certainly fine too. But what questions do you have for me at this point?
Hi, my name is Lindsay. I have a quick question about the budget and the project period. When we're putting together the budget, if we wanted to put some of the funding towards personnel or anything else, you said the funds need to be expended by the end of January, but the project period goes through August of 2018. So does that mean we would build the budget basically just for costs from June through January?
Yes. Thank you so much for asking. You are absolutely correct. Please prepare your budget to align with that June to January 31st timeline. And that really is because that has to align with the availability of the SHIP funds during this grant year.
Great, thank you.
You're welcome.
Mary, this is Pam. If you can, if there's, for example, a conference on telehealth that occurs in May, let's say, can you prepay expenses, hotel and airfare by January and count that?
Well, Pam, of course, that is an amazing question. I am so hoping that Ann Watkins, I know, is on the line. So your question is, even though the event itself will occur in 2018, so during our project period, but after the funding ends, can you use SHIP funds to make that purchase?
Mary, this is Ann. I am on the line. Can you hear me?
Yes, thank you, Ann.
Okay. Unfortunately, CMMI is very restrictive about the use of conference funds for this type of activity. So I would say, I mean, I'm willing to check that, but typically they are exceedingly restrictive about using SIM funds for attendance at conference. And again, this goes to the fact that they feel the conference benefits the individual, and they look at the provision of SIM funds as system delivery funds, so they want designs related to systemic types of programs, hence, telehealth programs and that sort of thing. So off the top of my head, I would say it would not be an allowable expense, but certainly if you want to include it in your budget, we can submit it, and then if it's not accepted, they will just restrict or deny that portion of the funding.
Okay, thank you.
Thank you, Ann. Any other questions? All right, well, hearing none, we are going to go ahead and sign off. And again, we will post this to the SHIP website. But if you think of anything later, or you have questions, or you simply need clarification, I'm happy to help you. Please give me a call or send me an email. And I do appreciate your time and look forward to receiving an application from you. Thank you so much.